Alya Shakir, the CEO of the Harley Street Health Center. Today, we are very lucky to be joined by Dr. Enam Abood, our head doctor and family director. Thank you so much for being here today.
Well, thank you for inviting me.
One of the things you mentioned when we were preparing for this conversation is you're seeing more patients come into the clinic with blood in their urine, either when they have noticed it themselves or when we have tested and found microscopic red blood cells. And I just thought it would be helpful for everyone watching and listening to know more about the causes. And I thought you'd be the perfect person to help us learn about that.
Well, thank you, Alya. It's a very important subject, really, because there are people who have microscopic blood in their urine, meaning invisible. They don't know that it exists. And there are people who've actually noticed blood in their urine. So I'll talk about the microscopic group first, and also we have to talk about women and men, because women, particularly women who are still having their periods, that's a possibility. Beginning just before the period starts, just after the period starts, ovulation time, they could have some of the vaginal discharge could be mixed with the urine. Anatomically, the opening of the urethra, which is the opening of the urine, very, very close to the vagina. So there is a mix-up. That is very easy, can happen there. So we need really to be 100% sure we're not dealing with this fact. Men and women, usually, let's say if they've been intimate the night before having the test, that can actually cause it both in men and women. There is also a silent, what I call it, the silent urine infection. Silent urine infection, it happens particularly in older people. They don't have symptoms. Elderly people, usually when they get urine infection, they can get confused rather than having burning urine or anything like that. So you can actually find microscopic blood in their urine. There's also sometimes, let's say, a small polyp up in the bladder, a polyp meaning like a mole, a raised mole on the skin, that can actually keep on producing a small amount of blood. So if there is a microscopic blood in the urine, we need to look at it further, bring the patient again, ask them not to be intimate for the day before, and recheck it, but we might need to send it to the lab to be cultured to make sure that there is no infection there. So that is the first category. Second category, which I think it can be more serious reasons than what I've just mentioned, is people have actually seen a blood in their urine. Generally speaking, younger age people, I'm talking now about men. So a young man comes and says, oh, there is blood in the urine. That can be either with symptoms, so like burning urine, more frequency, wanting to go and urinate more frequent than normal. That is an indication, most likely, of an infection. So that's really need to be treated as such. So we send the urine sample to the lab to culture to see what is the germ there, but we start on antibiotics straight away. So that's one of the easiest things to deal with. But if the man says, oh, I'm losing lots of blood, but there is no other symptoms, that can be a little bit more serious. So maybe there is a polyp, or could be benign, could be malignant. So that really needs further intervention, and it needs to be done sort of urgently. So a referral to a specialist.
So when you say malignant, we're talking about possible cancer here?
Possible cancer, yeah. So it could be just, it could be like something in the bladder, could be something in the urethra, could be something higher up in the urinary system. It could be also, there are injury to the kidney by a stone, for example. So this needs further investigations.
Does the prostate have anything?
I'm talking about a younger age group. What happens in a younger person, is, let's say, somebody in their 20s and their 30s. If there is a prostate issue, usually is a prostate infection, which there will be some blood happening, but mainly microscopic blood, but there is pain. So the man comes with pain, right. Usually not necessarily there is a blood in the urine.
Right. Yes. But if say you're dealing with a man over 40.
If I'm dealing with an older man, I mean, these days there is lots of evidence that a prostate cancer can happen to younger men in their 40s. So if there is a blood in the urine, I'm always thinking something sinister, really. Okay. Especially the lack of pain, that there is no pain, like so there's no indication of prostate infection, for example. So we need really to intervene and immediately, so that further investigations and management should happen.
Right. And in women, what are the
in women
causes?
Again, age, periods. And if there is also, if this blood in the urine accompanied by symptoms like urine infection symptoms, which is pain, especially, and very burning urine and going to the toilet frequently. But if there is, we need to always make sure in a woman, the source of a blood, is it vaginal, is it urinary? As I said to you a few minutes ago, it's the anatomy. One is opening is very close to the other. So it could be the blood's coming from the vagina. So it is really, we need to do internal examination just to make sure where is this blood coming from.
In women, are there any incidences of blood in the urine being connected to any cancers?
Absolutely. That's what I mean by the vaginal bleed, because it could be coming from the cervix. So we need to understand if she's really been bleeding. Is it after sex bleed, if anything like that happen? But also it could be sometimes bladder cancer, or just not cancerous but benign polyp that is bleeding. It could be a stone, and then so talking to the patient, knowing the history, because if a stone passed, it would be extremely painful, and we really need to know. So that is a very important sign of something that is sinister might be going on in the background.
One of the things that is interesting is sometimes, especially with men, I think, there's a delay seeing a doctor when they find blood in their urine. Why is it important for men to immediately come see a doctor when they find that?
Because it is a sign, it must be a sign of something going on, because men don't have periods. So it cannot say it could be contamination from the vaginal bleed. So having blood in the urine, it is a sign of something going on. So never ignore it. Straight to your doctor and this is my symptom, it's just happened. Don't wait, hoping that it will disappear. Just go. It's very important. And we hope that it is infection that is causing it, nothing else that is really more sinister.
So the advice is go straight to your doctor. And in terms of general urinary health, seeing as we're on the subject,
yes,
what are the ways that people can ensure that their urinary health and their kidney health stays good?
Get well hydrated. Water, because kidneys are there to purify our blood, and concentrated urine, like when we are not drinking enough water and we get dehydrated, will increase the chance of having bacterial infection.
That's really interesting. One of the things I was reading about is the tendency in, say, older men who, for example, have more urinary frequency or difficulty holding their urine because of, say, an enlarged prostate, in response to that, stop drinking water because they don't want to deal with the urinary urgency. Obviously, that can cause some real issues, right?
Absolutely. It can increase the risk of an infection.
Yeah.
And apart from the infection, dehydration can affect mental agility, concentration. It can cause brain fog. It can make the blood pressure drop. It can make the individual, especially older people, gentlemen, they can fall. So that is really very, very important. And on that subject, I can only imagine how difficult it is for them.
Yeah.
It can be socially embarrassing. But there are now, in the same way that there is underwear for women who don't then need to use pads or tampons during periods, they did exactly the same for men with this sort of a problem. So they can just wear their underwear, they are protected, it's not going to leak.
Yeah.
And I think that's very important that older men understand that this is available.
Yeah, and it's available from local pharmacies and
local pharmacies. There are some places that department stores sell them, and also I would ask the GP for a prescription.
Yeah,
you know, so because it is a medical condition, and this is very important that dignity is protected, and also there is no limitation to social gatherings, because that's very important, because that will create loneliness and depression.
Yeah, that's absolutely true. So sort of the tendency to want to isolate.
Indeed.
Yeah, I understand that totally. And it is a really challenging thing to deal with, isn't it? Urinary incontinence. Especially.
Absolutely.
So blood in the urine, essentially, never ignore it. That's the takeaway.
That's the takeaway.
Definitely go see your doctor right away as soon as you notice it.
Absolutely.
And always assume that it's caused by something, at the very least an infection, and at the worst possibly cancer.
Absolutely, because why would any human being bleed unless there is a reason?
Absolutely.
Absolutely.
Well, thank you very, very much.
It's a pleasure.
And I look forward to speaking again.
Thank you, Alya.